pain is the most mysterious sensation that we human beings experience. You've got to treat it that way.
Wow. What are the things that you wish people in pain knew? And what do you wish are the one or two things that you'd start doing right now? We're going to get into like a lot of the protocol and like more specific stuff, but just a bit of like, here's the North Star of what's possible. Because you may be right now in a day-to-day life where you just think you're stuck with this back, or you're stuck with this knee, or you're stuck feeling like this forever.
You know, I preface all these conversations I have with patients with a reminder that, look, I don't want to say anything that's going to minimize their pain. Because I think when I say something like all pain resides in the brain, I'm not at the same time saying it's all in your head. Those are two different things. And I'm saying this as a neuroscientist. But all pain is in the brain. That I don't want that to sound minimizing, okay? But that is where pain is. Pain is in the brain. If your brain doesn't decide you have pain, then you don't have pain. And by the way, the flip is also true, which is the brain can decide you do have pain for no reason. People who have limbs that are missing, they have phantom limb pain. How could that be? That it's not even there anymore and it still hurts. Or something known as chronic regional pain syndrome, which is basically pain in your hands or feet without any injury or any obvious trauma or anything. So, you know, I start there often when I talk to patients, just sort of reminding them of that for some reason, no fault of your own, but there's this memory loop that is continuing to get replayed over and over again that's causing that pain. Let's address that in some way. Addressing that baggage as much as you're addressing the pain. It's not, I think the one of the questions that I think a lot of people have is why? Why does the body do that? Is it a glitch of our central nervous system to just keep playing those memory loops? If you talk to people like Bessel van der Kolk, who wrote this great book called The Body Keeps a Score, I think what Bessel would suggest is that there's something else that's probably happened in your life. And maybe you can't remember it, but the body keeps the score. And maybe by addressing some of those things that perhaps aren't in conscious awareness for you, you're not thinking about day to day. Like you're not thinking about why your jaw hurts. You're not thinking about why that might be necessarily. Trying to treat the symptom more than the cause. And you may not be able to identify the cause yourself.
But here's what I find super exciting about this. Because, you know, when I've been in pain, I want to defend it. Because it feels very real. But if you could just open your mind to the possibility that maybe you don't need to fix your back or your leg or your neck, maybe that part of the solution is really addressing the memory loop that's playing in your head, that opens up a whole different possibility and an avenue of treatment and pain relief that you haven't even considered. In fact, you write, I want to read to you from your blockbuster book, It Doesn't Have to Hurt. This comes from page number 9. The point is that the brain creates pain on cue from a vast array of stimuli: biology, psychology, social, emotional, environmental, even cultural. And just as we now understand that the brain can be nurtured, developed, and optimized at any age, there's growing evidence that the brain can also rewire itself in ways that change the neural circuitry for pain.
Yes.
Really?
Yeah.
Reducing its intensity or duration and potentially eliminating it altogether. So you're saying that there's growing evidence that your brain can rewire itself and change that memory loop and the neural circuitry for pain, even pain that happened a long time ago that you're still remembering.
Still dealing with, still remembering. Neuroplasticity, you know, which is sort of the name for this larger concept of being able to change your brain. There's this phrase, I think it came from like the 1940s, Heb was the doctor who coined this, but basically neurons that fire together wire together. The thing about neuroplasticity that I think a lot of people don't realize is that it's not an inherently benevolent process, nor is it malevolent, nor is it bad. It's neutral. It'll kind of do whatever you ask it to do. So if you're hyper-focused on the pain, you're firing neurons together and they're going to wire together, and that's going to reinforce the memory loop. What is, I think, fascinating about pain is that pain circuits travel and they go through all these various areas. Your amygdala, which is your emotional center, it tends to be larger in patients who are in chronic pain. Their prefrontal cortex tends to be smaller. So their judgment and things like that tend to not be as good because their prefrontal cortex is shrunk to some extent. But it also goes through the hippocampus, which is your memory store. So you might start to really remember it well. Your past experiences with pain, you remember those and they may amplify your current episode with pain. So every time you start to have a twinge of pain, it's like, man, it just like skyrockets. It's like it just went from 0 to 100 just like that. And I've seen this in patients, even like in real time. They'll be in my office, Mel, and they'll sort of be there. And then all of a sudden they're cringing. Nothing happened to them, right? It wasn't like they fell or anything. They're just sitting there. Like, what is going on there? Why is that suddenly gone from 0 to 100 or from 10 to 100? A lot of that is because this very complicated sort of loop of pain circuitry, including memory.
Well, let me ask you a question. Just like even in the basics, so I kind of understand this. When that object hits my foot, right? I'm taking it like the skin and nerves and everything send a signal up to the brain in nanoseconds. And then your brain has to, like a supercomputer, register what just happened.
Yes.
Why does it tell me it's painful?
Well,
what is the purpose of that?
So if it's an acute pain, it's, oftentimes it's to teach you a lesson like, hey, Mel, don't be a klutz. Don't drop that vase on your foot anymore.
Yes.
I mean, it's the same thing with, a hot pan or stubbing your toe on the corner of your bed.
That
whatever,
I understand.
right. All that, it's all part of these
warning
are lessons.
System.
These are the warning systems. But, your brain in some ways is the ultimate regulator of your pain. And it's kind of like you're scrolling your social media feed. Okay, just imagine the brain scrolling a social media feed.
Okay.
It's like da-da-da-da-da. And then all of a sudden something incendiary pops up. Okay, that's the vase falling on the foot. And I'm thinking, wait a second, is that real or is that fake? First of all, the brain's deciding all this in a split second. And then it's starting to take all these other things into account. Has this happened to you before? Did it hurt last time it happened to you? How much did it hurt? Any history of depression, anxiety, all these different things come into play. That's the thing. When I started writing this book, I thought I was pretty smart on this because, 25 years I've been taking care of patients with pain. And I learned a lot. And, it's a fine line trying to navigate how to teach people about pain versus just treating their pain.
Right. And also, since it's such a brand new way to think about it, without making someone feel disempowered, because even if your brain is misfiring, you're the one that's still feeling it.
That's right. Your brain is now deciding this is a more significant injury.
Got it.
And,
it's organizing a response to get you to take action, because if it's more serious, you need help or people around you need help and you got to do something. So the pain is like an alarm, ding, ding, ding. Move, do something.
That's right. Pain is an alarm system in many ways.
Well, I was just thinking about the fact that if that vase were not pottery and it were, let's say, Tupperware, if it hit the foot, even at an object that size, my brain would notice, but it would also register as not as painful.
That's right.
And so I can see what you mean, that what's happening to your foot or your hip or your back or whatever, or your tooth is just happening. It's your brain that is kind of registering how much we're going to care about this.
Yep. And deciding then what your experience is going to be.
Got it.
Yeah, have you ever seen that experiment where they take a hand and then they take a dummy hand and they put it over here? And then they start, your actual hand is behind the back. And then they start sort of touching the dummy hand and touching your hand in the same places to sort of like, I'm touching this finger.
You mean like they're touching the dummy hand and you feel that in the hand behind your back?
They're touching your hand in the back as well. So they're basically trying to get you to correlate the dummy hand with your hand. Okay. And so then all of a sudden the dummy hand starts to feel like your hand. And all of a sudden they take a hammer and they smash the hand.
And then you pull your hand back.
And you're like,
Right.
It's not even your hand.
Well, I don't even have the dummy hand and I felt like it was coming.
Right.
Well, because the mirror neurons are firing.
That's right. So, the idea that you're tricking the brain, obviously, but the point is not to trick the brain. The point is to show you that all pain exists in the brain. Your brain decided that hurt, even though it wasn't even your hand.
This is like a whole new frontier in science.
It really is.
I really understand this now. in the example of dropping a ceramic vase on my foot versus a Tupperware one. And I understand that it creates an alarm system, right? That is designed to get you to really like pay attention. Like, we got an issue here. This is threatening you. Deal with it. Which is why if you don't feel pain, you're not even going to pay attention to it, right? If you have more like a structural issue, so you've got a disc problem in your back, or you have arthritis in your knee, does it work the same way, or how is that different, or is it different at all?
I think it's different because when you have a structural problem, whether it be in your spine or a joint, you're continuously activating those pain receptors.
Okay.
And so that is a little different than somebody who basically, you look at them and there's nothing going on here structurally, anatomically, otherwise, there's no injury, whatever it might be. So then you have to focus more on what other parts of this pain system are not working properly. And that's all going to be in the brain. So, like Rich Roll, I talked to him the other day. He had a very significant spine problem.
Oh my gosh. And he did surgery where they went in the front and the back.
Front
Dr.
and
Gupta.
the back. Yes. Rich is a good friend. We were talking throughout that entire process, and, he's a Ultraman athlete, I think he was shocked at how much his post-op recovery sort of took. Now, one thing that Rich would say if he were here was that he'd been dealing with chronic pain really for 13 years, since 2012. And part of the reason that it took a lot longer for him to heal, and he's still not completely recovered from a pain standpoint, his pain, which was acute back in 2012, started to basically be encompassed by all this baggage that we talk about.
Yep.
And Rich, as smart as he is and as resilient as he is, probably wasn't addressing the baggage that came with this. That idea of even a guy like him, so this should, he's an Ultraman, he's an athlete, he takes great care of himself, yet he still had this because of that added baggage. I think now that he's addressing that more, I think in a very, very intentional way, he's starting to get relief from his pain.
I would love to have you just tick off before we jump into the protocol that people can follow. What constitute baggage that creates a greater pain sensation and goes along with it, so that as you're listening on behalf of yourself or a loved one, and you may have a structural issue, you may need surgery for something, you may need physical therapy, but there's probably some things that are weighing you down that both increase pain and also help alleviate it and help accelerate your healing. So what is like the top 5 things of baggage that you tend to see?
Previous history of pain is a big one. If you've had pain in the past, then you have a relationship with pain. And for many people, that amplifies a future pain experience. Depression. About 40% of people with chronic pain also have depression. Anxiety. Mostly untreated forms of this, but even in people who have some forms of treatment, they may still have added chronic pain. Poor sleep. That was a big one. That was a big one. And again, it's a bi-directional sort of relationship. Pain worsens sleep, sleep worsens pain. But those are some of the big things, I think, that have always felt a little squishy in terms of the relationship to pain.
What about high levels of stress in your life? You mentioned depression, anxiety, a history of pain, which I would think makes you brace more for pain.
That's right.
The not
sleep,
getting enough sleep,
Yep.
stress. Is there anything else that you think is important for somebody to like, okay, check, check, check. These are things that I need to look at.
I think certainly how we move, how we nourish ourselves, and how we rest.
Okay.
I think are things that are important with all chronic diseases, but especially with pain. And I think the idea that as a general rule, if you're told that you're in pain, you're told to not move, to sort of stay still. And I think the data is very clear on this, that's not the right answer. Look, if you have a broken foot or something like that, no one's telling you to walk on that. But for the most part, movement is really important.
Let's talk about the MEAT protocol, because now you're going into movement. So I really want to talk about what to do. And you write and unpack the MEAT protocol, but what is it?
This is an acronym, and it's to be sort of a countermeasure to the RICE protocol. If you sprain your ankle, for example. So RICE is rest, ice, compression, elevation. Okay. First of all, mobilizing which is the M in meat, then exercising, continuing to actually be actively moving, analgesia or pain medication if you need it, and treatment, such as physical therapy, things like that, tend to be much better in terms of preventing chronic pain. So might it hurt more in the moment to not ice it, compress it, elevate it? Yeah, it might. But what you're trading off is a decreased likelihood of developing chronic pain.
Why would resting develop chronic pain?
When I was working on the book, I really wanted to try and answer a question, which was, who is more likely to develop chronic pain? So, it seemed like a fair question. Not everyone develops chronic pain, despite the numbers as high as they are. Most people don't develop chronic pain, but who is? And I started talking to these researchers, and they were asking the same question. And one of the things they found was that at the time of your injury, whatever it might be, the people who had the lowest levels of inflammation were the most likely to have chronic pain.
Why? Because wouldn't you want to reduce inflammation? That's why I'm resting and elevating and icing and compressing.
I think what the researchers sort of realized is that when you are sending all those healing molecules to your site of injury, letting the body do its job, it's actually pretty good at doing that. All that swelling and that inflammation, again, if it's broken, go get it treated and get it fixed. I'm talking more like a sprained ankle or something like that, something that's non-surgical. If you allow the body to do its job, then it's more likely to sort of do the job in the moment and not sort of layer out your pain over weeks and months. It's almost like you're going to hurt a certain amount. Do you want it to hurt now for a little bit, or do you want to have that pain continue for a long time? I'm greatly simplifying here, but that's sort of where these researchers landed. They said the least inflammation was the most problematic. And what do we do when we rest and ice and compress and you elevate? You're decreasing inflammation. And we just learned that decreasing inflammation is more likely to result in chronic pain. So we do things because they feel good in the moment, but not necessarily good for us in the long term.
So what does movement mean if you're hurting? Like light movement, like just stretching it, rolling it, like that kind of thing?
Yeah, mostly not resting, getting up and walking around, going for walks still, it might hurt again but for most people, continuing to move it, getting those, if you have to imagine those healing molecules getting to that site of injury and sort of doing their job. The body does a remarkable job of actually treating pain and treating injuries if you let it. But so much of what we do is sort of interfering with that process. We're blocking it by decreasing blood flow to the area, decreasing inflammation, all with the hopes that we're going to get rid of the pain and it's going to go away forever.
Well, what's interesting is that if I think about this in a common sense standpoint, if I am feeling stiff, if I sit, I'm going to get stiffer.
I know, right?
If I stretch,
yes,
which I would assume is sort of what you're talking about, because you're actually in stretching your muscles or reaching for your toes, you are signaling and sending more blood flow and molecules to those areas that are tight. And so stretching kind of blows when you first do it first thing in the morning because you're creaky, and at least I am, and you can't. But it's kind of amazing how after just 5 minutes of moving and stretching, your body is designed to feel better, to loosen up. And that's kind of what you're talking about, isn't it?
That's right. People who are moving into older age, where they're just constantly moving, they're far less likely to have chronic pain.
How can you start to retrain your brain to experience pain differently? Because I feel smarter. I feel like I'm getting this.
You're going to be the best judge of how to retrain your brain. And what I mean by that is that just simply paying attention to your pain and maybe even keeping a pain journal for a period of time to
Wouldn't that make it worse?
Well,
or does it make it better? Better because you're now starting to go, you know what? I'm going to stop assuming I'm in pain all the time and I'm going to start to notice when I'm not. Is that what you're doing?
I think you're trying to find the things that are correlating with your pain.
Oh.
Every time I talk to my mom, my back hurts a little bit.
Well, that may be your mom, not mine.
No, I'm kidding, Mom. She watches your show. So I got to say
we love you. You did a great job, Mom. But that's going to cause you a lot of pain. He was just kidding. Can you give me some examples of what you've seen that have a correlation to when people's pain spikes?
Yeah. So, sometimes it can be really obvious things. Some people are going to hurt more in the morning. Some people are waking up in the middle of the night with their pain. Is the pain worse in the morning or at night? What things make your pain better or worse? besides medications I'm talking about. I always feel okay when I'm doing X, Y, or Z, and starting to dig into those types of things. I think the point a little bit in terms of training the brain is that no one has really been talking about this. I'm not the first by any means. Guys like John Sarno, people have done this for some time. But the idea that it has largely been ignored, looking at these other things. Maybe medications are necessary for certain things like migraine headaches. There's new classes of medications, neuropathic pain. That can be, that sort of lancinating, terrible lightning-like pain that you get in your arm or your legs. Some of those, you may need medications. But the idea that despite those medications, you continue to have chronic pain. What are your triggers for that? Figuring out what those triggers are will, I think, be the first step towards training your brain. And I don't want to over or underemphasize the value of true brain training, whether it be meditation, whether it be virtual reality. I would say, look at the data. I mean, I'm not just telling you this. And I was a skeptic of this. I'm a neurosurgeon. I'm the guy who opens the head and, does things to the brain. The idea that meditation could cause these changes. We now know meditation objectively and measurably changes your brain. It causes thickening in certain areas of the brain that help reduce chronic pain. So there is really active brain training that can help you in the moment and help decrease your pain long term as well. And these are all within your reach. I mean, you don't have to go to some fancy clinic to be able to do a lot of this.
So many people deal with back pain. Are there things that you found in all this research that are kind of top of the list to lessen back pain, Dr. Gupta?
If you've, again, get it checked out. I mean, I evaluate a lot of back pain, make sure there's not a structural problem like our friend Rich Roll had, something like that. Let's say you've looked at everything and they say, hey, all your scans and everything are normal, which is what happens 90% of the time when I see a patient, x-rays, MRIs, all that sort of stuff. Then I think, really understanding that the back is something that I think a lot of people will rest in response to pain. They sit a lot. And when you're sitting, you're basically axial loading that part of your spine a great deal. So despite the fact that you're told to rest, I'm going to sit down instead of stand, that's probably making it worse. And I think as a general rule, sort of applying the same MEAT protocol for this, the mobilization, the exercise, and reminding yourself that there's nothing toxic happening in my body. People will say, I don't want to go for a long walk or do something like that. I'm going to hurt, my back hurts. I'm going to damage it more. No, you're not. If you've already checked that out and you can check that part off the list, like you're not damaging your back to go for a walk, then when you actually go for a walk or actually get mobile, you are probably going to actually help relieve your pain. Think about recruiting those healing molecules to actually go to the site of your pain and help. Chill out those nociceptors, decrease the amount of transmission going to your brain and, help you feel better.
What about the person that's scared to? You know what I'm saying? Because I think when you're in pain, because I mean, it was like, you're right. Because if you think about how stiff most of us are in the morning, a little bit of stretching, like it loosens things up. But if you're in chronic pain, I think there's a fear that you're going to injure yourself and make it worse. So if you talk to your doctor and you don't have a structural issue, and it's just the pain and the fear that's keeping you from trying a hatha yoga class or rolling out a mat and doing a gentle stretching routine or going for a walk.
Yeah.
What would you say to somebody who's scared or afraid they're just going to make it worse?
First thing I would say is I understand. I get that. That is a common way of thinking. We looked at some studies that basically showed that if you could explain to somebody that their pain is being generated in a way that is not continuously assaulting their body, that there's not some toxic force inside their body, they're not going to damage themselves by doing these types of movements. That seemed to really be helpful. I think it was close to 60% benefit in terms of overall approach to how they were thinking about their chronic pain and their likelihood of actually moving instead of just, lying in bed or resting all the time. So it is an important conversation to have, but I think people often assume because pain is an alarm system that if I'm hurting, that there's something wrong.
Yes, of course.
But at some point with chronic pain, it's not that there's anything wrong anymore. Maybe it's a glitch in the central nervous system. Maybe it's some repressed sort of thing, like Bessel van der Kolk talks about. But it's not a structural problem in your back. You should move.
What I love about what you're saying is that And I really think I'm getting this. And I really hope as you're listening and you're watching this, that you're starting to really get this too, that unless it is an acute injury right now, or unless a medical expert, licensed doctor, professional has told you that you have a structural issue that prevents you from doing certain things, that thinking about it in the area of back pain as your back is your back, but the pain center is up here in your mind. And that if your doctor or medical professional has said that it is safe for you to start moving, then the only thing stopping you from one thing that could make you feel better is actually the thing that's playing in your mind.
Yeah.
It's not located in your back. It's
That's
a hard
right.
thing to wrap your brain around, but when you explain it that way, and I'm like, oh, it's a glitch. And so the glitch up here is keeping me from doing the one thing. And just think about how much better you feel when you just stretch a little, or you just like stretch your legs and go for a walk around the block. You always feel better.
You do.
But if the glitch in your brain scares you and makes you think it's going to get worse, you won't do it. And what you're here to say is, if your doctor says this is going to be good for you, then you gotta stop letting the glitch in your mind from preventing you from doing these simple things.
Yeah. I think that's exactly right. Evolutionarily, it made sense that if you felt pain, you were going to resist doing things. You were going to treat it like an alarm. It makes sense that is how we humans evolved. Chronic pain, I don't think, was on the bingo card when we evolved. You know, the idea that pain would come and stay, I think that mystifies people still to this day.
Yeah.
Certainly mystified people in the beginning. Like, can you imagine? Like, what is happening to me that I continue to hurt despite the fact that nothing is happening in my body? Why does this thumb still hurt from a hammer blow, several weeks ago? Whatever it might be. But the idea that the body is actually pretty good at doing its job. What we have said in response to chronic pain is, don't let the body do its job. Ice it and compress it and elevate, and don't move and rest, and all those things prevent the body from doing its job. Once you're convinced, and you should be convinced by a really honest conversation with whomever about your back or knee, whatever it might be, that there's not something that's continuously activating those pain receptors, then think about movement. Think about exercise even.
I have TMJ, but I didn't even consider that chronic pain.
Right.
It bothered me so much, I actually got surgery on the joint 20 years ago. But as I'm sitting here—
Did that help?
Oh, it helped a lot. But so did the fact that I wear the bike guard. But I'm also hearing you talk, and I'm like, well, actually, the more I've prioritized sleep, and the more that I'm moving my body, and the more that I manage my stress, funny thing, I'm not grinding my jaw into the ground as much anymore, and it's not as painful.
So,
it used to lock, Sanjay.
Really?
And I'm about to turn you into our personal team doctor here and ask you a bunch of questions.
Okay.
But, the NIH says more than 10 million people in the U.S. live with jaw pain.
I think when you look at temporal mandibular joint, so this joint in here.
Is that what TMJ is?
TMJ, exactly. Temporal
Really?
mandibular
That's a
joint.
mouthful.
Literally.
Yes.
But, for a lot of people, there's different reasons for it. But one thing I would say is the numbers have gone up pretty significantly over the last couple of decades. Why would that be? We're not eating different foods necessarily. Like, why would our jaws be hurting a lot more? And I think it's, goes back to many of the same things that are driving a lot of disease in our country. Again, you think of heart disease, you think I'm eating too much meat. Yeah, maybe to some extent, but there's also the stress that you live in. People who are socially isolated have more heart disease. What's the relationship there? Even if they're healthy eaters, we find that isolation triggers pain centers in the brain. My point being that there's lots of things that could be sort of driving the TMJ, and many of the ills of our society are the same things that are driving chronic disease, drive chronic pain. So, getting to the root cause, you clearly had some root causes with regard to the amount of stress and everything else in your life. I don't know if you saw someone who's a specialist to deal with that part of your life. Maybe you did, but if you did, the idea that you're doing it because you want to fix your jaw, right? I want to fix my pain. So I'm seeing a psychologist.
I love this paradigm shift that you would go work on your mindset.
Yeah.
And work on your stress levels.
Yes.
And work on your resilience.
Yep.
And that would cure your jaw pain.
Yeah, or greatly mitigate it